Hello, everybody. Nelson Berger here with ExcelMale.com and DiscounterLabs.com. Today, I have the honor and the pleasure to have my best friend, one of my best friends, Shaun Noorian. He's a CEO and founder of Empower Pharmacy, the largest compounding pharmacy in the world. Um, I've known Shaun since the beginning, 15 years ago, and he's here in Houston, where I live also. And he's here today to explain to us medications that help with erectile dysfunction, premature ejaculation, all things related to that. We'll leave testosterone and other products for the rest. We're going to be doing maybe a few of these podcasts. So, Shaun, welcome. Finally, I get you on one of my podcasts. How are you doing today?
Hey, doing great. Thanks, Nelson. It's been a long time coming. Really excited to tell your viewership about all the different medications that are available to patients like us that could benefit our performance, our lives, and the quality of lives of those we interact with. So really excited to talk about these medications and how compounding pharmacies create solutions for patients and providers.
And Shaun, just because you're an engineer like I am, and we're working in this field, tell the audience why you started doing this and how long ago, and a real brief description of your evolution in this whole field.
Sure. So I was lucky to get introduced to the compounding industry as a patient. About 16 years ago, I was diagnosed with low testosterone at the age of 25. And my doctor was very wise. I was very lucky to see a great doctor here in Houston. He sent me to a compounding pharmacy to be able to fulfill my prescription. And that was, of course, these medications, being hypogonadal my entire life, and then being introduced to testosterone completely changed my life. And of course, I became so passionate about the medications that I was taking. I wanted to help others change their lives as well. So I decided to start my own compounding pharmacy and got licensed as a pharmacy technician and got to work giving patients like myself what we would want from a pharmacy experience. And what do we want? We want low cost, we want high quality, and we want good service. And so just taking the patient's perspective and growing upon it, and of course, introducing a lot of the quality and efficiency manufacturing techniques that I learned as an engineer to the compounding industry helped us grow it to become one of the largest in the country today. And also an outsourcing facility as well, which is a type of compounding pharmacy, except it's registered with the FDA and makes drugs not just for patients, but specifically for providers, institutions, hospitals, and now pharmacies to then administer those medications to patients in office or redispense to them. So over the years, we've been able to grow what we like to think of as a vertically integrated pharmaceutical supply chain, serving the health and wellness industry, touching every single pharmaceutical end user in this country with quality, affordable medication so we can live healthier and happier lives.
Well, thanks a lot for that intro. Hey, let's jump into what most guys are probably here listening for, to product. I want to go through different products, the different formulations, what they're supposed to do. You mind sharing the screen and showing us your brand new site? Because I just realized that yesterday that you had a really very fun, nice, beautiful site with all your products. So you guys can check empowerpharmacy.com. And we're going to basically be focusing today on men's health, erectile dysfunction, premature, and delayed ejaculation. We only have time for that today. We've got 25 products on this. And as you can tell on the left-hand side on the menu, there's so many other categories and types of drugs, not only for men, but also for women. So we're going to go through all that eventually in the future podcasts. So Shaun, just start and go for it. Like the first one is one of the most popular ones, Bimix.
Yeah, so Bimix is an intracavernosal injection, which means it's an injection that you inject into the side of your penis where you have your corpora cavernosa. And those are the two tubes that fill up with blood that create an erection in a male. And what Bimix does, it's a mix of two different medications, hence the bi. It's a mix of papaverine and phentolamine. And papaverine and phentolamine are vasodilators and smooth muscle relaxers. So it causes the corpora cavernosa, the tissue, to be able to engorge with blood and achieve an erection. Of course, with all medications, there are risks to and side effects. The most common side effect of this medication is priapism, which is an erection that lasts longer than 4 hours. It's primarily caused by the papaverine. And so most providers, when putting a patient on intracavernosal injection therapy, they'll first give them a test dose in an office and test for venous leakage using ultrasound to make sure that this is indeed the right medication for the patient to have. And then at the same time, they'll give them, they'll see how the patient responds in office, and then give them a little bit of phenylephrine, which we'll talk about shortly, to be able to create detumescence or reduce the erection. And so that's, but we typically see for intracavernosal injections, patients being started with Trimix, which has 3 ingredients: papaverine, phentolamine, and prostaglandin. And usually, we get about probably 90% or more of our intracavernosal injections as Trimix instead of Bimix, or the more powerful one, Quadmix. Usually, when a provider takes a patient from Trimix to Bimix, is when the patient complains of injection pain, which is usually caused by the prostaglandin. And so by removing the prostaglandin, it's a less painful type of injection, but it's dependent on the patient. Some people feel pain and some people don't. And so that's, Bimix is a very popular medication, bi, tri, and quad, the ICIs as we call them, intracavernosal injections. And those are usually given to patients that are no longer respondent to PD-5 inhibitors like sildenafil, tadalafil, vardenafil, or avanafil. So that's the next line of therapy when it comes to treating a patient with ED, when the PD-5s are either no longer effective or cause side effects that the patient is uncomfortable with, like headache or nausea, or in some cases, seeing blue. It's very rare though. And ICIs are also very effective, but only, just like all forms of ED, they are progressive and they typically get worse over time. So eventually, just like a patient will become non-respondent to PD-5 inhibitors, they may also become non-respondent to intracavernosal injections. And then after that happens, the next line of treatment is penile prosthesis.
Yeah, well, before we go that far, I just want to remind everybody that all this information is also on excelmale.com. I provide a free 20-page booklet, PDF that you can download on the pros and the cons and the side effect management for all these ICI products. So you don't have to, you can educate yourself, because these products are great. They're highly effective, but you really need to educate yourself and also your doctor sometimes. Let's move on to cabergoline and oxytocin, et cetera, et cetera.
Yeah, so cabergoline, it's primarily used to lower a hormone that is created primarily by women, but also by men, prolactin. And prolactin can cause ED in men. It's primarily the hormone that's used for secreting breast milk in women. But we have a little bit of it in ourselves as well. It should be very, very little, if not any at all. But when a lot of men sometimes create prolactin, which causes, you may see nipple tenderness, you may experience what may be thought of as gynecomastia, or just the breast tissue getting bigger. And when that happens, prolactin can cause erectile dysfunction. So that's why it's included in this list as well. But we see it very rarely used in our male population, as having high prolactin levels is not very common. The next drug, and please, Nelson, if you ever have any follow-up questions or want to add anything,
let me add something here.
Not be included, please feel free. A
lot of doctors don't check prolactin, and prolactin, especially if your testosterone, your baseline, your first testosterone test was under 200, and you were not exposed, obviously, to drugs that decrease the testosterone to that level. Doctors, the ones that know what they're doing, they check your prolactin blood levels. You can also check them on discountedlabs.com, my company, where I sell affordable lab testing that you can buy yourself without a doctor's visit. But many doctors don't check prolactin. Prolactin is also very important if you're not responding to testosterone replacement, and something is going on within 3 to 4 months. Some doctors go ahead and check your prolactin. If it is high, then one pill of this drug once a week is more than good enough to bring it down. So just to clarify that, yes, I'm sorry to
Yes, yes.
keep
Thank you, Nelson. And please,
interceding and interrupting
you're
you.
such an encyclopedia when it comes to this. And a lot of the stuff that I know today is because of your books and your forums.
Thank you.
So please, thank you very much for providing that information and teaching us. And if there's anything that the student has left out, please take over and fill in whatever is necessary for your listeners and viewers.
Thank you.
So the next drug that we have on our list here is oxytocin. Oxytocin is a hormone that's secreted by the pituitary that is known as the love hormone. So whenever you feel that bonding feeling of somebody when you first, when you kiss your girlfriend, or when a mother has her child, it actually creates a huge release of oxytocin that bonds the child to the mother and also serves to create milk letdown during lactation, as soon as a female patient has that. Of course, us men doesn't really occur. It's not very useful for us, but it is useful in the way that it causes us to bond to others. So patients that have a physiologic aspect to their erectile dysfunction, we see providers sometimes utilizing oxytocin to be able to help them bond with their partner better and achieve an erection if that is indeed the cause of their ED. We also combine, there are many studies showing that combining oxytocin with a PDE5 inhibitor will actually, in many cases, make that PDE5 inhibitor more effective. But especially in patients that have this a psychological barrier to being able to achieve an erection. Of course, we also have those in oral discerning tablets that can be put underneath the tongue or between the cheek and gum to be absorbed buccally or sublingually, but also in a nasal spray for patients that want a quicker onset of action, as that can be, in many cases, can be absorbed faster than a tablet sitting in the side of your cheek. Then the next medication we have, which we were just discussing along with Limix, is phenylephrine. And phenylephrine is a vasoconstrictor. And so why would a patient want to use a vasoconstrictor when using a medication that causes vasodilation? Well, this is also used in the case of priapism, where an erection may last too long. And what we compound is a diluted version of phenylephrine. Phenylephrine only comes commercially in a 10 milligram per ml formulation. Of course, that is a little too potent for use in detumescence. So what happens is we compound a version about 1/10 of that strength that patients can inject also into their corpora cavernosa if they do experience priapism. But that's typically second-line therapy. First-line therapy for priapism in many cases is pseudoephedrine, where a patient, if they start seeing that they're getting ischemic priapism, which is a form of priapism where blood doesn't flow, it gets stuck inside of the penis, which can be very dangerous because if blood doesn't flow, it loses oxygen. Once it loses oxygen, it starts to coagulate, and if the blood starts coagulating inside of the penis, then it becomes very difficult for that blood to then come back into the body. And the tissue starts to go through necrosis, which is very dangerous, tissue death. And so you can actually have permanent ED if you experience priapism and don't go seek treatment after 4 hours. So a little note, if you get priapism, definitely do what your doctor says. Many times the doctor will tell you to try first-line therapy, which is Sudafed. And if that doesn't work, then if they've given you a vial of phenylephrine, that's the next thing to try. But if that still doesn't work, then you need to go to the hospital very quickly. And then they can treat you by other surgical methods if necessary. So those are the two medications we have to treat priapism. Nelson, did you have anything you want to add to that?
I just want to tell everybody listening that this happens rarely, like within, I would say, no more than 5 to 10% of patients. usually the urologist or even primary care doctors prescribe Trimix when they have enough information. They really teach you how to titrate, and most people don't need more than like 0.12 cc's. That's with an insulin syringe. That's almost like a drop of liquid. You don't need more than that. So I tell the guys, obviously read all the stuff that I have on ExcelMale on this, and also talk to your doctor. Obviously, listen to your urologist, and never inject more than once. And, even if you're not responding, don't inject again. You're just gonna have to let it go because it can accumulate. So there are at least 25 to 30 ways to prevent priapism and prevent even the use of any of these compounds and have a potent, strong erection, an hour, 2 hours. When the erections last for 3 to 4 hours. That's when it really becomes dangerous. And some people, minority of guys that don't know what they're doing, end up in the ER to get their penis basically drained, all that blood that has been accumulating. So, anyways, sorry, I keep interceding, but there's so
No,
much
no.
info, especially in the injectables. This is probably out of all the whole field and area of sexual dysfunction, erectile dysfunction in men, is the one that requires the most training and the most information. But also they are the most effective, and they have changed lives. I've seen guys basically they save their marriage because now they can have sex like they used to when they were 15. So they're potent, but at the same time, they require a lot of education. Anyways, I'm sorry, keep going. Then
Oh,
we have
absolutely.
then
Thanks
we
for
have the champion, what mix?
Yeah, right, exactly. Yeah, and you're absolutely right. I don't mean to scare patients from trying these medications, but it is very important that you utilize a urologist or provider that is trained on how to utilize Trimix. By borrowing your buddy's Trimix and trying it on yourself will most likely end in priapism because the starting dose, especially for patients that don't have advanced erectile dysfunction, is very small, like a drop. 0.05 cc's is typically what patients start on and then go up from there all the way up to about half a cc. And then after half a cc, that's where it's typically we see patients going towards prosthesis. But these medications can be very safe if utilized effectively and with the supervision of a trained provider. And that provider will start you on a very small amount and escalate slowly over time as the patient becomes less respondent to that same exact dose. So it's primarily the papaverin that causes the priapism. So dosing the papaverin properly is very important. Of course, there are options if priapism happens on any dose. Other types of medications that are either just prostaglandin by itself or phentolamine by itself, or oral forms of medication. And then so talk about, let's filter by injection. So we just talk about the ICIs together right here. So here we have Bimix, Trimix, and of course the champ of them all, Quadmix, which is a mixture. It's pretty much Trimix plus atropine sulfate. So it's got papaverin, phentolamine, prostaglandin, and atropine. And that's typically used in patients that have become less respondent to Trimix, as the atropine adds a little extra effect to the combination therapy. Okay, and if we go from there, then we have good old sildenafil, the very first PD-5 inhibitor, brand name Viagra. And what we do as a compounding pharmacy is we make sildenafil in an oral disintegrating tablet, whereas the traditional drug, Viagra, comes in an oral tablet that you swallow and then sits in your stomach for several minutes before it disperses and becomes bioavailable. With an oral disintegrating tablet, it disintegrates within 1 minute. And usually, sometimes providers have patients stick them underneath their tongue, so they may be absorbed sublingually, directly into the bloodstream, faster than it could be if it was swallowed and then absorbed through the stomach. And so, of course, we also carry traditional tablets, but for compounding pharmacies, we see providers utilizing us primarily for our ODTs. And then we have different combinations of sildenafil with other drugs known to potentially help with blood flow or arousal. So we have sildenafil with apomorphine. Apomorphine can also help. It's a dopaminergic drug, so it helps release of dopamine, which can give patients let them become more aroused. So with this combination, you have a drug that can improve vasodilation and nitric oxide production. And then also you have another drug that may improve libido. So we see this as a popular formulation for men that have a difficulty achieving erection, but at the same time, also a mental block to be able to getting aroused. Of course, then we have sildenafil and oxytocin, which works on different mechanisms of action, but also helps with arousal for patients that may also have physiologic erectile dysfunction and psychologic ED as well. And then we have a combination of sildenafil with tadalafil, or brand name, also known as the brand names Viagra and Cialis. And of course, Cialis is has a much longer half-life of about 14.7 hours, whereas sildenafil has a half-life of about 4 hours. So tadalafil is much longer acting, but some patients, they respond better to sildenafil. So for this drug, we see many providers prescribing it when they want the short-acting benefits of sildenafil, but also the long-acting benefits of tadalafil. And please, Nelson, if you ever wanted to interject, please feel free to.
Now, let me ask you a practical question. Some physicians may be watching this podcast, and obviously they're not used to prescribing compounded products. Okay. So how do they learn how to, like, for instance, prescribe any of this? Do they contact your pharmacist, on how to write the script and actually fax it? How does that work?
That's a great question. Most providers learn several different ways. One is they go to forums like yours and they see what patients are taking, what providers are taking, and they learn from patients and colleagues as well on their prescribing habits and how compounded medications are being utilized to potentially improve outcomes versus the traditional medications, commercial medications. Another way is that they go to conferences. So they'll go to ED medications, like the Sexual Medicine Society of North America is a great reference when it comes to utilizing medications like this to treat sexual dysfunction. Or they'll go take courses, online courses that talk about these different types of medications that may be utilized in practice. And then another one is they can always call our pharmacy and speak with a pharmacist, a medical affairs pharmacist that is trained on many of the different areas of treatment that we specialize, or the specific drugs that provider may be curious about utilizing in their own practice. So many different avenues for a patient or a provider to learn about these medications, as well as visiting our website. And every single one of these pages, every single one of these drugs has its own product page where it'll talk about each individual ingredient, its mechanism of action, its contraindications, interactions, adverse side effects. So there's a lot of different avenues for patients and providers that are interested in learning about these medications.
Thank you.
Well, thanks for asking. Great question. And if we go a little further down, then we have sildenafil mixed with testosterone. And for patients that have ED, but also need are looking for a boost in libido, testosterone is known to potentially increase libido in male patients. And this is, since these are done in a trochea. Trochea is, it's kind of like a wax-like dosage form that you can place beneath your cheek and your gum or underneath your tongue and have it absorbed directly into the bloodstream, which may be faster than other dosage routes. And since testosterone, patients most likely want to do this medication about 30 minutes before planning on having sex to make sure that both the testosterone and the sildenafil have taken full effect. And so patients may feel more arousal and through the testosterone as well, but also being able to perform better with the sildenafil. And then we have the next drug that came out after Viagra, Cialis, the next PDE5 inhibitor. And Cialis goes by the name of tadalafil as its generic name. And just like sildenafil, we also make it in an oral disintegrating tablet that patient that may absorb faster if placed underneath the tongue, cheek, or swallowed, since it disintegrates faster than an oral tablet would. Of course, we carry the oral tablets as well if patients, providers want the traditional medication, the commercial medication that comes in 2.5, 5, 10, and 20 milligrams commercially. Of course, with us, we can make any dosage form and any dosage strength as a compounding pharmacy. So the provider determines that the patient may need a little more or a little less than what is commercially available. They can then utilize a compounding pharmacy to fulfill that medication. We also make tadalafil in troches in case the patient prefers to absorb it buccally versus swallowing a tablet that dissolves quickly, like the ODT. And then we have the same combinations that we do with sildenafil, where we combine tadalafil with apomorphine and oxytocin. But we also, since tadalafil is has become over the years a more popular medication than sildenafil has because of its longer half-life and a shorter onset of action, we have a few more formulations of tadalafil. And one of them is combining it with phentolamine mesylate. Also, the active ingredient in bimix, trimix, and quadmix. So this is combining a PDE5 inhibitor with a vasodilator, smooth muscle relaxant, to be able to potentially help patients that are maybe not as responsive to just monotherapy by itself. And then tadalafil tramadol. This is an interesting medication for patients that may have rapid.
I think I lost your sound. Say that again. Yeah, we lost your microphone.
Can you hear me now?
There you go. Okay, we're good.
Okay, perfect.
A little more volume. A little more volume.
Can you hear me now?
Yeah, a little louder.
Let's try this.
Seems like you touched something and it disconnected, but say.
Is this working now?
Yeah, that's fine. That's good. Thank you.
Okay. Sorry about that.
Let's go back to that to that tramadol story, which is very interesting to say the least.
Yeah. So tramadol and tadalafil. This medication is primarily used for patients that have rapid ejaculation, or when they ejaculate sooner than they would like to. And tramadol is a pain medication, but used in a low dose, it can actually be used to inhibit ejaculation. So providers, we see that for patients that have both ED as well as rapid ejaculation, this can be a very powerful combination for those patients. Because it is a controlled substance, tramadol, it is like an opioid. It is a controlled substance, and so it requires a prescription from a provider. You can only get about a maximum of 90-day supply of this medication. But the dose of this tramadol is much lower than the dose of the commercial medication. So most patients won't get its pain relieving effects, but they will get the effects of being able to find it difficult to ejaculate, which can help with someone that has rapid ejaculation. The next medication that we have is another PDE5 inhibitor that actually came out after Cialis. It's known as vardenafil under the brand names of Levitra. And vardenafil is very similar, if not identical, to sildenafil. It has almost an identical half-life, almost an identical onset of action, and many similar side effects as sildenafil, but fewer side effects as sildenafil. So patients that may have some side effects of sildenafil, like potentially back pain, blue vision, stuffiness, nasal stuffiness, those may be less experienced by using vardenafil versus sildenafil. Of course, these are oral disintegrating tablets, the ones we make. We also carry the commercial medication. And we also then combine vardenafil with other medications like apomorphine
to be able to help with arousal. Nelson, is there anything you wanted to add about sildenafil versus
Yeah.
dalafil versus
Well,
vardenafil?
yeah, of course. Yeah, I have a strong bias because I have all the side effects. Every single side effect that you're supposed to have, I have it with Cialis and most Cialis. Most people don't know that you can get back pain, you can get heartburn, sinus congestion, headaches, you name it. I get all of them. So vardenafil is actually the only one I can tolerate. Even Viagra will not is not good for me. So sometimes what I tell guys is don't give up. We have options. You can, if Bimix, for instance, you were talking about Bimix. I would say 80-90% of the guys, Bimix works. And Bimix is also very good because you don't have to refrigerate it, especially if you have to travel. So Bimix is a good starting point. Some people start with Cialis, the tadalafil, and they don't like it because they do get an erection, but they don't feel that great. They have to take a Prilosec and a Claritin, and then they just don't like it. So people need to know that if something doesn't work, you have other options. That's something that is a miracle. Even 10, 15 years ago, we didn't have that luxury, and obviously not the luxury of having a compounding pharmacy too, which is something else that most patients don't even realize. That's why we're doing this podcast, because people don't realize how many options they have. So just wanted to say that vardenafil is my drug.
Yep, well said. Thanks, Nelson. All right, and then to end this off, we also have our troches, which are similar to the ODTs, except they don't dissolve as quickly when put between the cheek and gum, so more of the drug can be absorbed through the sublingual or buccal mucosa versus swallowed and then absorbed through the stomach. So that's it for our ED medications. And Nelson, is there anything else you wanted to
Yeah,
add or
well,
comments?
why don't you do me a favor and go through real quick on the left-hand side that menu so that people know what they need to follow ExcelMale for. Subscribe to the ExcelMale YouTube channel. There are like 14,000 members there because you're going to get an alert every time I have a podcast with Shaun. And go under, explain to everybody just the different types of products that we're going to be covering next.
Absolutely. When it comes to men's health, it's not just testosterone and Viagra that we need, as many doctors will propose. There's so many other side effects or symptoms of aging that we experience. Of course, we see, if you look under our subcategories, the most common areas of treatment that we see are also deal with acne and hair loss. As if patients are taking testosterone, they may experience more acne and more androgenic alopecia or hair loss caused by androgens. And then, of course, testosterone, patients that may be hypogonadal, like myself, may also be infertile. And so and also testosterone is a potent contraceptive. So if a patient is on testosterone replacement therapy or has a hypogonadism, they may also need to combine their testosterone replacement therapy with a fertility medication like HCG or follicle stimulating hormone or others that the prescriber may determine is most appropriate, like a selective estrogen receptor modulator or otherwise. Another, I wouldn't say common, but this is a rare side effect for some men, is gynecomastia, which is the creation of breast tissue, which may be primarily caused by estrogen. And of course, the estrogen that we create in our body is aromatized from testosterone. So when male patients are on testosterone, the percentage of that is aromatized into estrogen, estradiol specifically, which may cause nipple tenderness or a growth in breast tissue, and which may have to be surgically cut out. So then we have medications that can prevent or reverse gynecomastia. And then there are many other hormones that we carry outside of testosterone. And as you can see, we have hundreds of hormones in our body. But these are the most common ones that we see prescribed for men's health purposes. And then also we have medications for prostate health, primarily benign prostatic hyperplasia, which is when the prostate starts to grow and prevents the urethra from being able to excrete urine from it, and also could also cause issues with prostate health. So, of course, then we have testosterone, which is, one of our largest categories, and we'll go deeply into this one. This will require a whole separate episode, as there's so many options when it comes to patients that are wanting to have go on TRT or other insulin medications, other metabolics that may be used for metabolic syndrome or wasting syndrome, or if your provider determines that gaining muscle will improve your health. And then, many of us, we may be obese or have weight management issues. So there's a slew of medications available to make sure that we can keep weight off, get weight off, and then eventually keep weight off. And these are not just oral medications. There's many injectables and other medications that can be used to help with this. And then, of course, there's overall wellness, where we have BCAAs, other medications that can help us work out better and also improve our performance. And also, we have antioxidants, B vitamins, everything else that we see many of our male patients taking to improve their quality of life. So yeah, really looking forward to having these upcoming episodes with you and walking male patients like ourselves to what we take and what we see most beneficial to doctors in our network.
Hey, thanks a lot, Shaun. This was great. I've been after you for a while, so I'm glad that finally I got you. And we'll hopefully do one of these every 2 weeks or so and cover. It'll probably take us 4 months to cover your products, but hey, it's a good start. So thank you so much, friend. And as I said before, subscribe to ExcelMale's YouTube channel, register on excelmale.com. If you need blood testing done by yourself, you can buy your own through discounterlabs.com. And also be on the lookout on Amazon.com. I have my new book called Beyond Testosterone. It's 447 pages, full color, of all about testosterone and beyond. So all my plugs at the end. Visit empowerpharmacy.com. If your doctor doesn't know about it, tell him or her that they can call a pharmacist there and find out some more information. So thanks a lot, Shaun, and we'll see you soon. Take care.